Here's the posterior abdominal wall with the arteries in place and the veins removed. Here's the abdominal aorta. It enters the abdomen by passing through the aortic opening in the diaphragm at the level of the 12th thoracic vertebra. The aorta runs down on the front of the lumbovertebral bodies just to the left of the midline. It ends by dividing at the level of L4 into the right and left common iliac arteries. The point where it divides is called the aortic bifurcation. The celiac trunk arises immediately below the margin of the aortic opening at the level of T12. It divides into three branches: the common hepatic, the left gastric, and the splenic. Between them, these supply the liver, stomach, duodenum, pancreas, and spleen. The superior mesenteric artery arises at the level of L1. Its branches supply the small intestine and much of the large intestine. The inferior mesenteric artery arises at the level of L3. Its branches supply the distal part of the large intestine. Of the branches of the aorta that arise in pairs, much the largest are the right and left renal arteries, which supply the kidneys. They arise just below the level of the superior mesenteric artery. Arising at about L2 are, in the female, the ovarian, and in the male, the testicular arteries, which run downward and laterally over the psoas muscle. 4 pairs of lumbar arteries arise from the back of the aorta. Here are the lower 2. They pass behind psoas major, where they branch to supply the back, the spine, and the abdominal wall. Lastly, here's the median sacral artery, which arises from the back of the aorta just above the bifurcation and passes down into the pelvis. The common iliac artery runs close to the medial border of psoas major. It divides here at the pelvic brim. Here's the external iliac artery. Here's the internal. We'll look at the internal iliac in the next section. The external iliac artery is the main artery to the lower extremity. It runs along the pelvic brim just medial to psoas major and passes beneath the inguinal ligament. Below the inguinal ligament, the artery goes by a different name, the femoral artery. Just before passing beneath the ligament, the external iliac gives off 2 branches, the deep circumflex iliac laterally and the inferior epigastric medially. Here's the femoral vein, lying medial to the femoral artery as it passes beneath the inguinal ligament. Above the ligament, it's called the external iliac vein. The external iliac is joined by the internal iliac to form the common iliac vein. The 2 common iliacs join just to the right of the aortic bifurcation to form the inferior vena cava. The right common iliac artery passes in front of the left common iliac vein. The inferior vena cava runs just to the right of the midline. It lies on the vertebral bodies from L4 to T12, then on the left crus of the diaphragm. It passes through the diaphragm here to enter the right atrium, as we saw in the last section. The 2 large renal veins join the inferior vena cava at the level of L2. This is the left testicular vein. The right one has been removed. To the main circulation through these large hepatic veins. The hepatic veins are very short. Their number varies. Here there are 3. They enter the vena cava just below the diaphragm. In this dissection, the peritoneum and fascia on the inside of the lower part of the anterior abdominal wall have been removed. Here are the external iliac vessels. Here are the inferior epigastric artery and vein. They pass upward and medially and run up the back of the rectus abdominis muscle. They enter the rectus sheath by passing in front of the arcuate line. The superior epigastrics also lie behind the rectus abdominis. To see them, we've removed the upper part of the posterior rectus sheath. Here's the superior epigastric artery, emerging from behind the costal margin and passing down onto the back of the rectus, its branches anastomose with those of the inferior epigastric within the rectus muscle.